Mefenamic acid is a nonsteroidal anti-inflammatory drug NSAID with analgesic and anti-inflammatory properties. Its pharmacology involves several mechanisms of action. Inhibition of COX enzymes. Mefenamic acid, like other NSAIDs, inhibits the activity of cyclooxygenase COX enzymes, particularly COX1 and COX2. These enzymes are responsible for the production of prostaglandins, which play a role in pain and inflammation. By inhibiting COX enzymes, mefenamic acid reduces prostaglandin synthesis, leading to decreased pain and inflammation. Pain relief. Mefenamic acid is used primarily for pain relief, especially in conditions like menstrual cramps, dental pain, and musculoskeletal pain. Anti-inflammatory effects. By reducing prostaglandin levels, mefenamic acid also has anti-inflammatory effects, making it useful in conditions with inflammation, such as arthritis. Antipyretic effect. Mefenamic acid can help reduce fever by lowering prostaglandin-mediated fever responses in the brain. Analgesic effect. It acts centrally and peripherally to reduce pain perception. Pharmacokinetics. Mefenamic acid is well absorbed after oral administration and has a relatively long half-life, allowing for less frequent dosing compared to some other NSAIDs. The dosage of mefenamic acid can vary depending on the condition being treated and individual factors. Typically, the recommended dosage for adults is, for pain and inflammation, 250 milligrams to 500 milligrams. Every 6 to 8 hours is needed, not to exceed 1,500 milligrams per day. Common side effects of mefenamic acid may include 1. Upset stomach or abdominal pain. 2. Nausea. 3. Vomiting. 4. Diarrhea. 5. Headache. 6. Dizziness. 7. Rash or itching. 8. Increased blood pressure. Mefenamic acid can interact with various medications and substances. Some of the notable interactions include blood thinners, anticoagulants. Mefenamic acid can increase the risk of bleeding when taken with blood-thinning medications like warfarin. Close monitoring of bleeding times may be necessary. Other NSAIDs. Concurrent use of mefenamic acid with other NSAIDs, such as ibuprofen or aspirin, can increase the risk of gastrointestinal bleeding and other side effects. Antiplatelet drugs. Combining mefenamic acid with antiplatelet drugs like clopidogrel may increase the risk of bleeding. Corticosteroids. Taking mefenamic acid with corticosteroids can also increase the risk of gastrointestinal bleeding and ulcers. Antihypertensive medications. Mefenamic acid may reduce the effectiveness of antihypertensive drugs, potentially leading to increased blood pressure. Lithium. Mefenamic acid can increase lithium levels in the blood, which could lead to lithium toxicity. Diuretics. There is a risk of reduced kidney function when mefenamic acid is taken with diuretics. Selective serotonin reuptake inhibitors (SSRIs). Concurrent use with SSRIs can increase the risk of bleeding. Alcohol. Combining mefenamic acid with alcohol can increase the risk of gastrointestinal bleeding and ulcers. Always consult with a healthcare provider before starting any new medication, including mefenamic acid, to ensure it is safe and appropriate for your specific medical situation.